Welcome back to the channel with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, my name is Peyronie and I am a board certified family nurse practitioner at RevitalyzeMD.
So today's podcast will be on Peyronie's disease, but not an overall Peyronie's disease, but on a specific treatment, Xiaflex, which is the only FDA-approved treatment for Peyronie's disease. So we're going to get into the details on that, which are very interesting. But before we do, please subscribe, and that helps grow the channel. And a lot of viewers aren't actually subscribed, and that's not just on our channel, but across the board. So please, if you love the content we're putting out or even like it, then hit the subscribe button, share with friends, let us know your comments. So let's go ahead and get into it. So Peyronie's disease, what is it?
Deep dive, right?
Yes.
Let's head right into it.
And this is something that we see in practice. So we see a lot of men with Peyronie, I shouldn't say a lot, but we see men with Peyronie's disease looking for options that don't involve medicines and surgeries because that's what they read about, and they're looking for providers that do that. And so that's how they end up in front of us. And so we're going to talk about what Peyronie's disease is.
Right. So Peyronie's is the development of fibrous scar tissue inside the penis, usually from trauma or vigorous sexual activity.
Yes.
Or
Which
penile breakage.
Yeah, vigorous sexual activity
That
could
leads to
be trauma, which then, it could be a penile fracture. And short of that, because a lot of guys don't recall exactly what's happened. So it can just be trauma, and then you have inflammation acutely, and then you have a scar tissue that develops after
And
that.
then chronic. And then it becomes a chronic disease.
So that scar tissue will cause a curvature in the penis. So if you have a curvature in your penis and you're wondering what the terminology is, that is Peyronie's disease. If it is a curvature, it's usually in the direction of the scar. And so if it gets to be a very fibrous area and grows over time, then that could be something that you can feel and palpate.
It feels like a fibrous band, almost like you've got a rubber band tied tight in one area, and you can see where that contraction is.
Correct. So you can actually start to feel that as it progresses. And so the symptoms that you can have are curvature or pain with erections. And eventually erectile dysfunction, is that due to pain, progressive, all of that. And so basically those are the issues. And so when you look at, and we've done another video that goes into all of the potential treatment options and which ones are FDA approved. So I would refer you to look at that. And if you want to know the overview.
And that is a great overview. Medications, non-medications, alternative treatment, surgery, it kind of lays it all out. And this one's just going to be very specific on the first line treatment that is FDA approved.
And the only FDA approved treatment. So the only FDA approved treatment on guidelines from the American Urologic Association were 2015 were the last guidelines. There is like maybe an internal educational CME update in 2022, but no significant changes to that we could find. And so we're talking about a very outdated guideline. And the only FDA approved treatment is Xiaflex, which is, do you want me to try it?
Or you go right ahead.
So Clostridium, actually collagenase, Clostridium histolyticum is the name. So CCH.
Or Xiaflex.
Yeah. So Clostridium histolyticum is really a bacteria that produces a collagenase, and that collagenase is an enzyme that goes and breaks down collagen tissue. So if you have a scar, you don't use that in the acute inflammatory phase. You don't use that until it's a fibrous tissue where the collagen is not aligned the way it should be, and you're using that collagenase to break down that collagen and therefore remodel the scar. And there's a reported 32 to 34% improvement that if you use that.
Yep. That study, I think, was 800 or 900
yes. And
participants.
There was like a 2013 study with, I think, 34% improvement. And then
the placebo is only 18.
Yes.
So not crazy difference of numbers, but what was interesting was the percentage that was happy with the treatment.
And when we're talking about 34%, we're not talking about 34% of men. We're talking about a 34% improvement. And so that would require, again, doing a baseline assessment of that, which could be, just a history, but getting details of what the man is experiencing, but also then doing it in office, injectable to cause an erection and to see and document that. And then a 34% increase. So that's a lot of stuff to do leading up to where subjectively, if a man is saying he has a curvature, he tells you where it is. Most of the time you can feel, palpate, and actually just
Even in
address
a
it with all
flaccid
those.
state, you can feel that fibrous tissue
Correct. And so
or
not
visibly
needing to.
see it in some severe
And I
cases.
think the reason they have to go through all this is because of insurance-based
Yeah.
models. And so you have to document to get in. But honestly, if a guy has a curvature and you can't feel, you can go to further lengths to do in an office induction of an erection and see. But most of the time you can feel that even in the
If
flaccid
you are
state.
coming into the office saying, I have a curvature, I have pain with erection, and my erections are changing, and I'm starting to experience erectile dysfunction, we don't need to do an ultrasound. We don't need to give you an injection to cause pain for that erection to see that you have curvature.
Yeah, and most of the scoring can be done even on erectile dysfunction just based on your reported symptoms and experiences with it. But anyhow, we digressed and now we'll get
Yes.
back to it. So that first study, 2013, was basically a study in about a 34% improvement in the curvature. And then a 2015 study that didn't have quite the improvement that first one did, but it did sustain it over a 52-week period, the improvement. And so that was a good thing for long-term safety and efficacy. And then there was like another study where it was a
A
32%.
32%.
So those aren't, that's improvement. That's a start. So, but there's side effects of that. And so, but the most interesting part of this you want to stick around for because it is eye-opening. Not only are these outdated guidelines, but the availability of the only FDA-approved treatment and what you have to go through to actually use that as a provider physician. But you have side effects you can do with, or that happen with Xiaflex, which would include, anything when you're putting a needle in something,
Right. Bruising at the site.
swelling, pain, those are all common things, even if you're doing, any injectable anywhere. But the more serious side effect being,
Rupture of the tendon.
yeah,
Increased risk of penile fractures.
yeah. So a 1% chance of a penile fracture with this. And so if you think about it, it's breaking down collagen, but if the tunica albuginea, which is right there too, actually has tissue breakdown, then you actually have a weakened area. And so penile fracture is reported to be a higher, and that's actually the Xiaflex is given under multiple sessions and so multiple injections. And so it's about a 1% risk every time you get a treatment, not just an overall.
So 1% every time. Pain and tenderness was reported in 40 to 60% of patients. And then what we didn't talk was a hematoma, so collection
Yeah.
of blood in the area, which was 30 to 40%
Yeah.
of patients. So there are definitely some risks with this injection.
So I would say 30-40% risk of all those like more minor and transient, but 1% risk each time you get an injection of a penile fracture, which is the more serious.
Serious.
And then obviously the most, and 70% reported satisfaction. And that's where we have some questions because we have never had a patient come to us that had a previous treatment with Xiaflex. So we want to hear from you and whether you've ever been treated for that, whether that's been offered up, and how frequently, because we want feedback on this because we're just not seeing it in practice, and our patients are looking for non-traditional options that don't include medications and surgery, and not one of them has ever underwent this treatment with Xiaflex. So please let us know.
Yeah. And that's why it's interesting because it's the first line. It is the Urological Association's guidelines,
Only FDA approved
the only
treatment.
FDA, and we don't see patients in our population being prescribed this.
So we have Peyronie's disease, a curvature with about a 10% frequency or incidence in men, with the only FDA approved treatment, Xiaflex, and a guideline from 2015, and it's 2024. And then now what we found out was also Xiaflex is no longer available unless you're certified to inject it based on like migration and safety, study, or a migration and safety kind of system that they set up, so that because the risk of penile fracture was so high, and it's still reported at 0.5 to 1%. So I'm not sure if there's some other data that we're missing or isn't quite
Or
as
something new
open.
updated, maybe in that 2022 update that they were seeing that we aren't seeing. Who knows? But
Yeah.
it is, I find it interesting that there is now this program around Xiaflex that you have to, as a provider, have specific training. You have to be certified before you can prescribe it. So maybe people aren't certified, and that's why we're not seeing patients on it.
And that brings us to the question is like literally we are almost 10 years behind on that guideline. So we're talking about American Urologic Association in a 2015 guideline for treatment for Peyronie's disease. So almost 10 years out with the only FDA approved treatment, and still saying emerging treatments such as acoustic shockwave, which we love with videos on for Peyronie's, that we'll talk more specifically about, but a ton of videos on acoustic shockwave. That's an emerging therapy. PRP injections or a P shot, emerging therapy. So we're 10 years out to update those. And then the one FDA approved treatment is no longer available, which brings you
Unless you
are
get
certified.
certified and trained specifically on it.
And I would love to hear how easy that is. So who's
Yeah.
certifying?
Urologist, are you listening? Leave
Yes.
comments. I want to hear, how hard was it to get certified? Is this a technicality? Is this a lot of hoops to jump through? Are you even prescribing it? Because the patients we see, they're saying, hey, my doc told me I can have surgery.
Yeah. And how easy is it to get certified? Yes. All those questions around
Yeah.
that
Please
certification
leave
program.
comments. I want to know. Inquiring minds want to
Yes.
know.
And it's called a risk evaluation mitigation strategy. That is the REMS certification. And now it's required by the FDA to manage and to use Xiaflex for treatment of Peyronie's disease, which is the only FDA approved treatment. So I would encourage people to look to those emerging therapies such as acoustic shockwave and PRP injections, and get on some forums and Reddit, and the P-Shot official site has a lot of forums for Peyronie's disease, and we have seen and treated Peyronie's disease with great success, and that's based on acoustic shockwave, PRP in combination, working on that plaque, and then also vacuum erection devices that are very useful as well.
Yeah.
So
But if you use Xyloflex and had a good reaction, bad reaction, let us know. Drop it in
yeah.
the comments.
All right. Well, we look forward to hearing your experience and your input. And just let us know if there's anything else you want to hear about. And don't forget to subscribe. And we're willing to deep dive into anything sexual wellness or wellness.